Thank you, Dr. Mahdi, and I want to thank the organizers for giving me the chance to highlight what's happening in Yemen in terms of COVID. And this is, I think, is very important for integrity of the work that we're doing and for disseminating right information about what's happening on the ground. So let me, if you allow me to share my screen, I have prepared a few slides. Let me start by shedding some lights on the on what's happening on the ground. Yemen has reported only around 60 cases with some 1,000 a little over 1,000 fatalities. These numbers are not adequate at all. They actually represent 1 over 50 or 1 over 100 because these are the total cumulative numbers since the start of the pandemic. The case fatality rate, according to those numbers, is 19%. And if you look, even with those little numbers, if you look at the pattern of registration of the cases, you would definitely see that there has been a first wave which has concluded probably last August, and then the start of a second wave that is currently ongoing in all governorates. So most of the governorates that are reporting, if you look at the names, never mind the bars, but the names are mostly coming from the south. The southern parts of the country, which holds 30% of the population, that are reporting as much as they can. The surveillance system is not that strong, but at least they are reporting. 70% of the country in the north are not reporting as such, according to one reason or another. We tried as WHO to get those figures, but it's very hard to do that. But how do we know that we do have that these numbers are 150 or 100? In last December, WHO conducted a seroprevalence survey by collecting blood samples of almost 2,000 people from Aden, in which almost 1 million population is there, very randomly selected from different suburbs and parts of the city. And in Aden only, where a 1 million population, it was discovered that 27% already have antibodies against COVID, meaning over 500 of the 2,000 had it. If we extrapolate, this means that almost 250,000 have been infected from the first wave. This study was conducted after the first wave was concluded, while we're only reporting 5,000. You can do the math and see how much it is. And of course, without proper data, how can we plan? But is that under reporting because of lack of labs? As you can see, the country has 10 functional labs that can test COVID-19. 3 are not yet functional, but we're working on their functionality. You know that sometimes they're missing kits, they're missing PCRs, and so on. But at least 10, and as you can see, they are almost distributed mostly on the north. There are also additional 8 private labs that help also in identification. In the death rate, I said that the case fatality rate is almost 20%, and out of 5,000 reported, almost 1,000 died. Is that because of lack of intensive care units? The answer is no. We do have 24 dedicated intensive care units in the south and a similar number in the north, a total of 48 in the country. And they are distributed between Aden and Sana'a and other governorates, as you can see. Some are still closed since last August, but they are reopening now, especially in the north. And there has been a request to WHO to support new ones with the PPEs, medical equipment, and consumables. So where are we going to, how can we as WHO support? There's a big funding problem in terms of and gaps. And as you can see, we have requested almost 142 million to be able to respond to the catastrophic situation on the ground right now. We had some, almost 23.5 million that is already in balance with us. 37.3 have been consumed since the start, but we've asked for additional $84 million, of which we only received 13%. And out of the 13%, we still need 6 million urgent right now to respond to the lack of beds, lack of oxygen, and many other issues that we see on the ground. And that's the balance of what we have right now, the 23 million. And as you can see, the purpose of this slide is to show you the generous donors that are contributing to the COVID-19 in Yemen. Islamic Development Bank, Korean government, King Salman Relief Fund, Tetra Pak, UN organization, OCHA, and then the World Bank. These are the ones that we have right now, and those are the current balances. Still, we need more. We need to mobilize more donors for the cause. So where are we going to use those urgent needs? As you know, WHO has divided the response of COVID into 10 different pillars, going from country coordination to risk communication to surveillance to points of entry to labs, infection prevention control, case management, operation support, and then maintaining essential health services while the pandemic is ongoing, plus vaccination. And these are the figures that are estimated by WHO. We're still struggling to find donors. I said that there is $6 million needed right now to respond, to be able to respond to the cases on the ground. At least $3 million of them is needed in the coming 1 or 2 months. The next one, almost $2 million are needed in June, July, and the remaining almost $1 million is needed before August or September, according to our estimation. And those are the short-term needs that those at least $6 million will satisfy according to each pillar. I won't dwell on the slide because of the time, but as you can see, WHO has a plan for each pillar, how much is it needed, how much is costed, and in terms of coordination, risk communication, surveillance, points of entry, and labs. These are the ones identified as a shortcoming in the next short time. I won't dwell on that slides, but definitely would love to share them with all of you to show you that there is a plan from WHO side according to what donors is coming, and that plan covers the 10 pillars, especially the COVAX vaccine, pillar 10, in which we have 360,000 doses received. I'm glad to say that only 2 days ago, the campaign started in Aden. Vaccination is ongoing, but we are lacking operational costs. Still haven't received any operational costs for that vaccine. We are waiting for 2 million doses to be supplied, which covers 23% of the population in 2021, and we don't have the whole operational cost for them. The plan is adequate that has been developed for COVAX. Whole of Yemen, it covers, prioritized according to WHO framework, and phase 1 that is ongoing right now covers the healthcare workers, people with comorbidities, and vulnerable populations. But there are still challenges that, as you can see, we're not sure of what's coming next, monitoring and evaluation, the lack of security, the distance, the coverage, the vaccine hesitancy because of rumors, and the uncertainty to cover the beyond 20% is bothering us. This is my last slide for you as food for thought to see how can we stop the surge of confirmed cases. The cost of transportation is killing WHO. It has increased 2-fold because of the problems and the logistics and the ongoing conflict on the ground. We are finding difficulty to find charter planes or procure from outside. Operational cost for COVAX, as His Excellency alluded to at the start of his presentation when he was cut, fuel, oxygen, incentives, water is a big problem. These are not normal WHO activities in countries. We are supplying this only in Yemen, trying to provide this to maintain the operation of health facilities. There are other pillars that are neglected completely: risk communication, community engagement, infection prevention control, points of entry are totally neglected and not supported by many donors. There is a gap of 83% funding gap that we need to look at. The resumption of essential health services is on top priority, not fully funded, and the surveillance and data is generally all over the country very weak. Thank you so much.